Hello there and happy Friday afternoon. Today we are diving right into functional neurologic disorders, talking about diagnosis, excuse me, I'm gonna close my door, and talking about coexisting conditions. And this topic came up actually from a question that a patient posed to me. He had been diagnosed with functional neurologic disorders, but was going to a movement disorder neurologist to get another opinion, and asked, like, what should I be looking for? What should I be asking for? And I was like, there's research on this, and a very recent article, which is a great review on functional movement disorders, which are a subtype of functional neurologic disorder where there's a movement problem. And that movement problem might be dystonia, it might be tremor, it might be myoclonus, it might be a gait disorder, it might be weakness. Those are all functional movement disorders. And so this recent article, which I'll share right here, was really helpful to describe these things. By the way, I didn't even introduce myself, and it's been a minute since I've been on here. My name is Julie Hirschberg. I'm a neurologic physical therapist. I'm the owner and founder of Reactive Therapy and Wellness. We're a neurologic rehabilitation group in the Los Angeles area, and I run education and mentoring for other clinicians. And we are actually running a functional neurologic disorder workshop for clinicians coming up in a couple of weeks. So, I'm going to be in the literature and looking at the research again, because every time we do a workshop for clinicians or for patients for that matter, we're looking at the evidence. We're looking at what the research says about this condition. So this review is really great. And in fact, when this patient asked me this question, I actually sent this article. It's called Moving Beyond Movement, Diagnosing Functional Movement Disorder. And one more thought here, if you're on our newsletter, I send out a summary of the articles, research, videos, things that we do every week. And this is coming today if you're a clinician and on our newsletter from reactiveeducation.com, or if you're a patient from reactivept.com, I sent a special newsletter to you. So what I love about this review article is that it gives a really great explanation of the diagnostic process. And the first thing I will say when it comes to movement disorders is I really firmly believe that people should see a movement disorder specialist. This is a person that sees tremor all the time, that sees myoclonus all the time, that sees gait disorders, and can differentiate a functional movement disorder from something else, and knows the testing to run, the genetic testing, the blood work, the imaging, the clinical testing involved. So movement disorder specialists all of the way. Now, I want to start with this diagnostic algorithm that they share in this article. So let me pull this up. I love this. Also, if you didn't know this about me, I'm a professor at the University of Southern California, and I teach physical therapy students all about the diagnostic process and screening process for physical therapists. And this is literally what we teach. So this is what I love. But for every disorder in the nervous system, we look at key components to get to a diagnosis. And while as a doctor of physical therapy, I don't diagnose a medical diagnosis, I do screen. So if somebody comes to me like this patient and says, I was diagnosed with functional neurologic disorder, does that match? I will screen it. And you know what? Sometimes it doesn't match. And other times there's other coexisting conditions. This is what we're trained to do. So this, I guess they call it an algorithm, diagnostic algorithm. These are the steps that a neurologist should be going through with a person if they're suspected, well, really any neurologic disorder, but a functional neurologic disorder. And it starts with a very, very good history. And actually in the article, I'm going to just pull this up. I don't think I have a visual for this. They have this really great table So I highly recommend this article that goes through the elements of the history that you would get, the details, and how those apply to the diagnosis itself. So from the history, and you can start to put together a hypothesis about whether this sounds like functional neurologic disorder. This is the same thing that you would do in Parkinson's or MS or a stroke. Clinically, you're going to go through that history and start to hypothesize. Does this sound like MS? Does it sound like a stroke? Where is this in the nervous system? So this is the process that every neurologist would do for any diagnosis. In FND, I think this history is even more important. The story is so important. So this does take time. This isn't going to happen in a 15-minute appointment. This should be like a 45-minute to 60-minute appointment. So from that history, the neurologist is then going to do testing with positive signs. And I'm going to share with you a table in a couple of pieces of some of the positive signs in functional neurologic disorders. And there are some tests that are highly sensitive and specific for functional neurologic disorders. Also important are rule out or negative signs. And this means those signs that are consistent with other disorders. So again, this is what I teach. If I have any PT students here, hey, if you're coming to my class, this is a preview. If you've had my class, this is a review. But we look at very specific central nervous system, peripheral nervous system signs. There are clear patterns that are consistent in the motor system, the sensory systems, the autonomic system, the cerebellum, and coordination and basal ganglia, all of those pieces. So we can clearly look at signs of other neurologic disorders. So those are rule out or negative signs. Very important in any neurologic diagnostic process that you have both positive signs and you also have rule out negative signs. This is really important in functional movement disorders or functional neurologic disorders because we often see them coexist with other disorders. So I'm going to talk about some of those coexisting disorders. I know somebody asked up above here, how often do you get FND with CRPS? So I'm going to show you actually that those two can go together pretty often. And we definitely see it as well. So from the history and then the clinical signs, then you put together investigations. And you know what? Investigations aren't always warranted, but if they are, it would be things like MRI and EMG, and other maybe physiologic tests, blood tests and genetic tests and so on. And then you put together those puzzle pieces that might lead to functional movement disorders. It might lead to functional movement disorders and something else, which is very, very common, which is why I want to show you this picture from the article too. I really appreciate, it got kind of cut off on the sides. The most common coexisting conditions or other functional symptoms alongside a functional neurologic, functional movement disorder. So I'm going to go through a few of these. Some of them are other functional symptoms. So along a functional movement disorder, there might be functional cognitive symptoms, might be functional seizures, there might be functional swallowing symptoms, there might be functional facial movements, all of those pieces. But things that we often see, and you can kind of see these down at the bottom of the picture, coexisting. So this is not the functional neurologic disorder, but coexisting and often predating our joint hypermobility. So EDS or other connective tissue disorders, pain or an injury, very, very common. Not listed on here, but also starting to be seen in the literature is autism as a coexisting condition. It's not a functional neurologic disorder. Long COVID as a coexisting condition. It's not a functional neurologic disorder. And listed on here, though, as a coexisting condition, POTS or dysautonomia. Again, that's not a functional neurologic disorder, but we see it coexisting. So to the person question, how often do you get FND with CRPS? In this picture, you can't see it at the bottom there, but they have it at the foot. CRPS is often in the picture of functional neurologic disorders. And in fact, it's really considered a type of functional neurologic disorder. A subset though, just like the cognitive is a subset of this. So really great question. So now I want to go back to those diagnostic criteria, and I hope that you can see this table as well. Let me see here. I think I got part of it, and of course it's super tiny. So again, I'll put a link to the article in the newsletter this week so you can see it. But what the table has along the left-hand side is the movement disorder phenotype, because there's a lot of different movement disorders: tics, weakness, tremor, dystonia, facial dystonias is distinct, gait disorders, and even Parkinson-like symptoms. And then you can see the two key positive diagnostic findings in functional movement disorders. Incongruence, and this is incongruence with other neurologic findings. That's upper and lower motor neuron disorders, that's upper or lower sensory symptoms, and really I should say central or peripheral sensory patterns, cerebellar signs, cranial nerve signs, and so on. So incongruence, and then inconsistency, which includes a lot of the variability and changes with attention. So I think in this one, it starts with jerks and myoclonus. This is kind of the bottom half of the table in the paper. And you can see things that are either incongruent or inconsistent with each of these. And one of the things that's really interesting actually when it comes down to tremors and jerks is you can now do EMG testing, and there's a distinct battery. They actually talk about it in the paper, and I'm going to quote here. They combine surface EMG with accelerometer, and for functional tremor, this has a sensitivity of 90% and a specificity of 96%. That's very high. So this isn't always done, but hey, this is a physiologic test that is a positive sign of functional tremor. What they do is they actually include a battery of tests with the accelerometer and the surface EMG. They do ballistic movement. They do a tapping task at various frequencies. They do look for coactivation prior to the onset of tremor. They look at increased tremor amplitude with loading of the limb, and what happens when they change the verbal cue for testing. So really interesting. The same thing can be done with functional myoclonus. So I think we're making progress here with even physiologic tests that are positive for functional movement disorders. Again, they're not always done. And what this chart shows is that actually there are clear clinical and positive findings that indicate the presence and distinction of functional symptoms over other symptoms. So really helpful. For this person who asked me a question about it, there was particularly, I'm going to pull this up, functional gaits disorders. And it's really interesting. This is not included in this article, but in other articles, there actually are consistent over hundreds of years of time patterns of functional gait disorders that are very common. So knee buckling, like you're walking on a tightrope, walking on ice gait, but you're not actually walking on ice, so it looks like you're walking on ice. And also, I think this is really interesting on economic postures. So that is one where the posture or the preponderance of the posture during gait is not energy efficient. And this can lead actually to a lot of fatigue in folks with a functional gait disorder. Those are some of the incongruencies, and the inconsistencies are when it's variable, when it normalizes with an external focus. This is why I love PT, OT, speech therapy for folks with functional neurologic disorders. So that would be an example of what a person might look like with a functional gait disorder. So one of the take homes with the positive exam findings is that there are different positive exam findings for each presentation of functional movement disorders. So you need to look for those. And in fact, this article actually has some really great pictures of very common presentations of different functional movement disorders. Super helpful. Okay, I've got 2 more pieces I think to share here with you. Now, let's go back to the history. Again, if you are a PT student that has taken my courses, or you're in our Brain Bites group, or any of the things that I do and teach and talk about when it comes to differential diagnosis, the history and the timeline is very important. And not only for functional neurologic disorders, but for all neurologic disorders. So what I love in this article is they actually put several different types of neurologic disorders and showed different trajectories. So for example, at the top, we see stroke, and we see this kind of flat line. And I would say, well, with therapy, that line's going to go up and improve, but that's a side note. This is not maybe with therapy. In the orange, you can see relapsing, remitting multiple sclerosis. In the yellow, you can see neurodegenerative disease. And then what you can see with a functional neurologic disorder is this time course that is wavy. So a lot of ups and downs, flares of symptoms, but we're like a fairly steep curve of worsening, and then if left untreated, staying at that level of disability and symptoms, which, I would say with all of these, with treatment, we can change some of the trajectory here, which is great news when it comes to doing therapy in any neurologic disorder, is that neuroplasticity is possible, and that we can change. We might slow down the trajectory of a progressive disease, for example. We can't change that the progressive disease is happening, but we can certainly slow it down, and we know we have tools for things like that. So this is a really important piece, and why that story and subjective examination is so very important. Now, the last piece I'm going to bring up here, or maybe second to last, is this. I think this is so important for us as clinicians. We need to recognize that as we dive into the world of functional neurologic disorders, not everything is FND, and there are a lot of coexisting conditions. Now, I showed that picture of the body with multiple symptoms. It was kind of cut off in this video, but we do that in a pie chart form. So when we are going through that history, when we are understanding symptoms, when we're listening to people, we're kind of configuring, wow, like there's multiple health conditions here. Migraines are very common in functional neurologic disorders. We are finding, and actually research is finding, Ehlers-Danlos syndrome or other hypermobility syndromes are common in functional neurologic disorders. We are finding, and others are finding, POTS, postural orthostatic tachycardic syndrome, or other dysautonomias are common in functional neurologic disorders. but they are not FND. And so we really need to consider the whole person, screen for other conditions, and consider that in treatment. I will tell you that the person who reached out to me about this diagnosis had said they spent 3 months in physical therapy and didn't get better, and in fact they got worse. And I think that's unacceptable. I think us as clinicians can do better. Sometimes what I've seen is that these other coexisting conditions are missed. And if those aren't treated alongside the functional neurologic disorder, I do think the person would get worse. I also think that there are overlapping pieces to functional neurologic disorders and POTS. Both have autonomic components. To Ehlers-Danlos syndrome or hypermobility, loss of proprioception or changes in proprioception in the joint, that also is contributing to functional neurologic symptoms. So it's so important as clinicians to screen for all of these and not to consider all of the symptoms being FND, but instead to consider that the person has both FND and. So I want to share one other picture here, and I see a couple questions, comments. By the way, if you have questions, comments, I love them. Please bring them my way, because it was literally a patient's question that led me down bringing back up this this particular article. Now, if you are a clinician, this was the picture I wanted to share, is I'm so passionate about clinicians who care and want to make a difference for people with FND and giving them the tools to do so. So I dive into the literature every single week, and we put together workshops to help clinicians. We have a brand new one. It's coming up this month, and we distilled down to 3 steps so you could have success with FND treatment. I hear from people of the overwhelm, or they got started, they don't know where to go next, or they don't even know where to get started. And that's what we're covering in this workshop. It's on September 19th and September 21st. We got 2 dates. It's the same workshop. We're just going to do it twice. And I hope you will join us. You can go to reactiveeducation.com, sign up, and we're going to be having so much fun doing this live. You get to bring your questions. We get to answer them. We'll go through our pie chart. We'll go through patient cases and really get to apply what I love to talk about in functional neurologic disorders. Now, so go get yourself signed up. If you are not a clinician, send this to your clinicians. I'm seeing a comment here. Can you please bring your knowledge and training to New Zealand? Will you send this to them in New Zealand, then, is what I'm going to say. Medical practitioners just don't know how to navigate our community. Yeah, I know. I hear that a lot. And I want to empower clinicians. That's why we do a lot of this. I share every week for free. We do free workshops because I think that's really, really important. So please share. If you're a patient, please share this with a clinician. And let's get them the tools to help you. Okay, and I see this other comment. I was diagnosed with FND in 2020 and you're from New Zealand. Welcome, and thank you for coming too. I just really appreciate that. And having some treatment, but very slow compared to other countries. So send this to them. Yes, okay. She said, I will send this through. Thank you so much. Yes. Somebody else said, please come to New York. Okay, so send this to your therapist, but I also have at least 3 or 4 therapists in our mentoring group. It's called Brain Bites. It's for PTs, OTs, speech therapists, psychologists, and we do a lot of diving deep into FND and other complex health conditions. We learn together, we support each other, we bring cases to each other. And I've got at least 3 folks in New York. So send me a message if you're looking for somebody who knows this stuff really well. I've got some great people I can refer you to in New York, both in New York City and upstate New York. They're phenomenal. That's one of the things I love about our Brain Bites community is we're in this all the time. We're learning together, and we really care about making a difference for some of these lesser known conditions. So yeah, please send me a message. What else? Can I say that you're a very calming and knowledgeable presenter? That is such a lovely thing to say. Thank you so much. I just really care, and I'm really passionate about this. So thank you, and thanks for tuning in too. Someone else, do you take international patients? So we're learning a few things about international patients, and at the moment we do not. But I will tell you that it is a possibility. So stay in touch, stay tuned. We do have folks that fly out and join us from other countries. And I always just feel so honored that they do. It's also frustrating. I would like them to have this in their home country, but I know it's not always possible. So we do, as when we work with patients, they are from all over the world. At the moment, we are not working virtually with people in other countries, but stay tuned because that is quite a possibility. I will tell you some of the things right now that are available in other countries. We run a whole wellness and fitness program that is adapted for people with neurologic disorders, adapted yoga, adapted mindfulness practice class, boxing, movement, balance classes, and it's online. We also offer it in person, but if you're international, it's online, and it's really reasonable, and it's super fun, and we have a wonderful community. It's a great starting point for somebody if you are international. So send me a message if you have questions about that. I'm happy to get you connected. We have the most amazing team in the world, I think. Leading classes, we have our physical therapist lead classes, our occupational therapists, we have neurologic personal trainers, yoga therapy, and they work with people with FND every single day in our programs and then in classes. So yeah, reach out to me. And I want to thank you all for your wonderful questions and for caring to make a difference in people with functional neurologic disorders. And again, if you're a clinician, join us for our free workshop. If you're a patient, send the workshop to others so that we can have more people helping folks like you. So thank you so much for joining me today. I really appreciate the community that we have around re+active, and I hope to see you again soon. Thanks so much.